Okay, we'll go ahead and do the welcoming, or should we wait a couple more minutes, Amber?
Maybe just a few more seconds while people get logged in here.
All right, I think it's just about the hour, so we'll go ahead and get started. Good evening, everyone. Thank you all for joining us today. This is an exciting webinar, and it's the second of a professional development series arranged by the Minnesota chapter of the American College of Cardiology. The first one featured Dr. Cherry Hall and focused on setting goals and priorities for early and mid-career cardiologists. And I'm privileged to host Dr. Moliterno, Editor-in-Chief at JACC Intervention, and Dr. Jneid, the Senior Associate Editor at JAHA, Journal of American Heart Association, as our guest for the second session today, which we entitled it Ask the Editor, and we really wanted it to be interactive to answer your questions. Thank you very much for joining us today, David and Hani.
Thank you. It's a pleasure.
Thank you for having us, Mohamad.
So, both Dr. Jneid and Dr. Moliterno graciously offered to do a presentation and prepare slides, but we got a lot of questions from the audience. So we prefer to really tailor it to what you guys would like to hear and go make it interactive and ask both editors about, just convey your questions and get their opinions. And I thought we will divide the questions into three pods based on how they came. The first maybe 15, 20 minutes will focus on the submission process. We'll just go over that journey of how you start and really ask the questions that you guys asked. And then everybody wants to know about the backstage and what happens in this secret, mysterious editorial board meeting. So we have a few questions about that. And then we will end up talking about, futuristic stuff. What is the future of medical journalism? What's the vision for, our societies and their journals in the future? So does that sound okay?
Sounds terrific.
Perfect. Thank you very much. So starting with the first one. So one question we have is, I am, let's say, an assistant professor or a fellow in training, and I have worked on this project for a while. I have my paper ready now. And, when we start, we always think that any project is worth the highest impact journal ever. And we get surprised when that's not the case. So how do I know? The question that came is, how do I know which journal or tier of journals should I submit my paper to? And maybe we'll start with David on that.
So I think it's a great question. It's something I think that every one of us who has published a paper has thought about and had to face. And I'd say two or three points to that one. One is, hopefully as a junior faculty, as a fellow, as an assistant professor, you have a mentor. And that person has obviously, hopefully published a number of papers in various journals and can help to provide guidance and insight. So that would be the first one, right? Is to reach out to your co-authors, to mentors, to get their input. What do they think? And usually that community thought, that community decision can help pick the best journal to start with. I think it's not uncommon, as you were alluding to, Mohamad, to maybe shoot just a little bit higher. Maybe, one notch up higher and, hope and pray that you get a favorable response. What I like to believe is that, a good journal is going to give you a good set of reviews. And so even if they don't accept the paper, you're still going to get good reviews. And so those are my first couple of thoughts. The third thing is, what I advise most junior people is just to read a lot. And if you're reading enough different journals, you're going to have a good sense for where your paper fits. And so I think between the mentor, your co-authors, and just your own intuition on where you think that paper best fits is probably the right place to start. But love to hear also Hani's input on that one.
So David, these are great insights. And I have little to add to your insightful inputs. I think starting with the mentor as well as the collaborators and co-authors is a great idea. What I usually do when I was more junior is And even now, whenever we ask the co-authors to do their final contribution and revisions, I'll ask them, where do you think this would fit? So you can poll your co-authors and maybe not only the mentor, but the senior co-authors to see where the journal would fit. The second idea that I want to add to what David said is also it's a good idea to have a good environmental scan. And I'm sure as the lead author of the paper, you've really researched the topic very well, and it's all included in your discussion, in your introduction. So you know where are the major papers in that field are published. So you would want to aim to I would say, higher impact paper to start with, aim high, and then you could always transition to a lower impact paper. But also you'd want to factor the novelty and whether there's any recent publication in that journal that covers this topic. So you would want to really not publish the second or third paper within the last 3 months in that journal on the same topic. So if that journal published this, maybe you want to steer towards a different journal. And then the advantages of journals like JAHA and JAC intervention, and I don't want to go specific into our journals, is the fact that these are what you call daughter journals. So even if you aim to circulation or JAC, they could potentially get referred to JAHA or JAC intervention. So there's a great advantage of aiming high to JAC circulation, and then it get transitioned and referred to us if it doesn't make it based on priority. And again, to re-emphasize or re-articulate what David said, it's great to go to a higher impact journal to start with and get the insights and the feedback and good comments from the reviewers, and then revise your paper accordingly and then resubmit.
And one observation that I myself have noticed relevant to this question is sometimes we have this notion that, this journal never publishes this kind of papers. And then a couple months later, we're surprised that actually, no, they did publish just one. Oh, well, maybe they do. So I think the idea is more important. Sometimes it's the database is weak or has a lot of limitations, but that's the best that's available. And the idea is timely and relevant. So never say never, because you'll be surprised how many times, journals will publish things that they didn't use to publish in the past. So great, thank you. The next question we have is, okay, now I've shared the paper with my co-authors and seniors, and I got their feedback, and now we're about to submit. I remember reading Dr. Moliterno's when he used to do the editor corner and talked about the categories of submissions and the cover letter and stuff. How important is the cover letter, and what should I include in it? How long should it be? Should I repeat? Some people copy paste the abstract, and I feel that it's a little bit redundant. So what do you want in a cover letter to consider really top tier?
So I'm happy to start. I think it's variable according to the journal. There are some key elements that all journals are going to ask for, right? This is an original work. All the co-authors have read and agreed to the paper's contents. It's not being under consideration somewhere else. And so, even if it's just a form letter, you have to say those things. You have to say those things up front. The time, I think, well, 3 or 4 more comments. Now, I think for junior authors, they should write cover letters for several reasons. One is they need the practice. They need to organize their thoughts. They need to convince the reader of the importance of the paper, and they want to introduce themselves, especially as an assistant professor. If you've got letterhead, great. Put your letter on that letterhead. It shows then your title, your academic degrees, and it's not only going to be seen by the editor-in-chief, but chances are other people who are maybe the reviewers or other people who are looking at that letter are getting a chance to see this person. Where are they? Things like that. I think ultimately the 2 or 3 things you want to convey is, why should they take this paper? And so it's giving you, not as you said, Mohamad, to just regurgitate the abstract, but just to give maybe 2 sentences about why you feel this paper is really important and why the journal to whom it's being submitted is the right journal. Why is it the right readership? There are other things you can put in there, like if you want certain people to review it or certain people not to review it. But I think the salient message should be is what is the key findings and why should this journal and its readers be interested in the paper?
Great. So David, very well stated again. So when I look at the cover letters, first I would love to see a cover letter that's not overlapping or regurgitating what's there in the abstract, because I will be going to the abstract and I don't want to get the impression that I'm reading the abstract twice. So what I would love to see the investigators say is try to convince the editor what's so unique about this paper, why it's a good fit for the journal, and whether it's building on a previous work that they've done, or whether there will be a future, and what's the implications of this paper, and maybe even whether there will be future work coming out to follow on this paper. So that's one of the things that I like to see in the cover letter. It's basically the first impression, really. And I was reading recently about something in psychology. It takes 80 milliseconds when you encounter someone to get a first impression. Maybe reading a cover letter, it's a little bit more time. But remember, this is your first encounter with the editorial board. And if it was badly written, by the way, make sure it's very well written, elegant, good verbiage, no syntax problem or issues, and put all your titles, qualifications, and provide a compelling reason why this work is unique. Things like the sample size, the strength of the database, for example, the uniqueness, and any additional subgroups that are of major clinical implications. I would highlight all these in the cover letter itself. And then if you had a work in the same journal that were published not too long ago, you could say this is to follow on a prior work that we've done and expands the field in this venue. So there's few additional notes to what David just articulated.
That's great. So not only state what you have in it, but you could also allude to some future work that you're planning to do. Is the cover letter the first thing that you guys read when the paper comes?
Well, in part you have to. That's the first thing. You see the authors and the title, but yeah, it's the first thing you go to. There are a couple other things we look for. If, for example, it's being accepted or presented at an upcoming society meeting, that's a nice thing to know. Obviously, if it's a late-breaking clinical trial presentation, so when Hani does a late-breaking clinical trial, I like it when he puts it in his cover letter, so I know to pay attention to it. I was going to say one other thing, sorry, forgot what it was, but so it is nice to have that information in there though. But no, listen, if it's a really great paper, I don't really care so much about the cover letter. If it's an in-between paper, yeah, then I think it's more important perhaps.
Actually, that's a great point David talked about. If the data are great, I mean, we also look at the abstract, almost never reject things based on a cover letter, but you look at the abstract, and if the topic is very interesting, very novel, obviously you bypass the cover letter. But let's say if you had a really bad cover letter, full of mistakes, very short, very not personable, then that's really a killer. So you would want to have a very good first impression. Yeah.
Great. That's awesome. So that takes us to the next question. Maybe we should have done this before that cover letter question, but a lot of people, maybe we got 7 or 8 questions talking about the source of data and what kind of research can people do, especially in low resource places. Not everybody has access to, CRT kind of databases. Not everybody has access to, randomized trial data and stuff like that. So as you can see, most of our data are observational. And there are a lot of ambition, a lot of people wanting to do research, but we know that limitations of the observational database. And maybe, specifically, you guys both see a lot of increasing submissions from admin databases. And, some of them are well done, some of them are not so much. So what advice do we give for people who are in low resource setting, who would like really to publish and they're excited and they want to work, but that's what they have? To make their paper, to upgrade it to something acceptable to high tier journals. And having reviewed some of those, recent increasing submissions from administrative databases, what observations have you had? What advice you could give? Maybe we'll flip the order and start with Hani.
You would be a better fit, Mohammed, to answer this question because you do a lot of work from all these kinds of databases and tremendous work. And I know that JAHA takes a lot of paper from major administrative databases, and same thing as JAC intervention. I really think that clinical databases are very important. Administrative databases are also important and have their role. Um, uh, First, I think they complement each other and both complement clinical trials and higher level of evidence. You would want to really examine real world clinical effectiveness and these, besides efficiency in the trials, and these major administrative databases gives you a lot of insight on quality of care, temporal trends, and what's happening nationally and geographically. You can examine disparities, geographic variations, and real world outcomes. Now, the problem with this, what I like about these databases also, by the way, this is the 21st century, it's globalization and maybe democratized research. So there's no more few centers that have the resources and access to these clinical registries and clinical studies. And some of this access really has been monopolized. So the beauty about these databases, which I really like quite a bit, is it democratized research and it's facilitated access. And also it fostered relationships and collaborations. So I've seen a lot of multi-institutional collaboration from these databases. So this is all great. Clinical effectiveness, real world work, access to people who wouldn't have otherwise access to clinical registries and so forth. Now, want to be careful as you get more access to these databases. There's lots of overlap in the studies. There's lesser quality control over the data. There's issues sometimes, not sometimes, quite a bit with ascertainments of these codes. So misdiagnosis errors, erroneous codes, and so forth. So you want to make sure that the codes, the administrative codes are well validated. And what I ask my junior colleagues and my mentees and collaborators always, whenever we do these administrative databases, make sure that we're not publishing the first report on a code that hasn't been explored before. So if you want to do a work, for example, on acute MI, I would rather go with something like ST elevation MI, where the ICD code is unequivocal, well validated, with a good specific sensitivity, and rather than go over non-ST elevation MI, which is a mixed bag of type 2 MI, myocardial injury, and real MIs. So you would want to be very careful with the code's ascertainment and with your topic. You want to also make sure there's no overlap, because lots of overlap. Actually, there's one time we had two analyses happen sequentially coming to our journal, exactly same topic, same years from the same database, same 2 periods of years. It was amazing. And what was refreshing when I presented the second paper is the measures and outcomes, and the numbers were exactly the same. So that gave me a lot of confidence in both groups of authors, how accurate they were. But then we had really to go with apologize for the second group of authors, because we already moving forward with the first one, and almost identical papers. The other thing I want to say is the statistical methods are very, very important. So the databases are not as robust as the clinical databases. So you'd want to really make sure that you've got the best statistical methodology there. Again, avoid overlap and go for codes that are well established. And very important, the last part is in your limitation subsection. This is the one time that I want to read an expensive limitation subsection. You want to really acknowledge the limitations of these databases. For example, in NIS and RD lack, or NIS lack of out-of-hospital outcomes, the issue of unmeasurable confounders, the issue of misdiagnosed errors, and so forth. I would leave it at this. Would be interested to see what David would say.
I'm also curious because, JAC intervention didn't take a lot of those papers in the past. And I'm seeing more, even in the main JAC, I'm seeing more of those being accepted recently. So looking forward to your input, David.
Well, let me go a different route with this. I think it's a mistake to get too enamored with publishing the best world-class research when you're starting out, when you're junior. And I suspect most people watching this will be starting out or relatively junior, right? And so what I tell them is, find something they're really interested in, something they're passionate about. And even if it's not the first paper out or the best paper, but just work on it. Because what it takes a lot of practice. It takes a lot of time, a lot of energy, a lot of thought. And so I think that very few people, very, very few, publish their first paper, right, in the New England Journal of Medicine or in Lancet or JAMA, right? They publish in lower tier journals. And so my point would be is don't spend an inordinate amount of time trying to come up with the absolute best research possible. Just get started and read and write. Read and write. That's what I tell people all the time is, if you're not writing, then read, because as you read, you're going to learn style and craft and thought and science, just like Hani was alluding to. If you read other papers that are good, and you'll learn their methods, how to write the methods section. You'll learn how to present data in tables. You'll learn how to present the limitations, not exactly what other papers had, but what your paper has. And so I actually just encourage the fellows in particular and junior faculty to grab a project, even if it's a case report, for goodness sakes, and do a really good job writing up that case report. Find images that maybe nobody else has put together yet for, maybe it's cardiac non-compaction and nobody's really looked at, the latest MRI signals or, just things that are really novel. That's the other thing I say is if your center has a particular strength, play to that strength. Go to the experts at your center and figure out maybe what your case has that they could bring to light for the readership. And again, it may not be a world-class journal. It may be a good journal, but it'll just give you the experience of going through that whole process of doing the cover letter, of working with co-authors, of the statisticians and the tables and the figures and things like that.
That's a great advice. Thank
So
you.
Mohamad, can I follow on David's excellent points? We have a minute to follow up. So obviously there are different types of learners. Some people learn by listening, some by reading, some by writing. I happen, for example, to be a learner by writing. And once I write something, I'll become the expert in it. And that's what I tell my fellows and mentees. And I had some of the mentees said, oh, you know what, this topic has been published in this journal 3 months ago. I said, of course, you're doing retrospective analysis or a review article or case report. It's extremely rare that you'll come up with the very first description of anything. I mean, just to re-emphasize what David said, you learn by writing. Many of us do, and most of us do, and some of us only or predominantly learn by writing. So you become the expert when you write. And then also don't underestimate the work you're doing. So some of my mentees said, oh, you know what, this has been done. I said, so what? Do it with a different twist in a different database with a more contemporaneous database, for example. Just go for it. And then don't always say, oh, I want to shoot. You have to shoot for the stars. But even if you get to a lower impact journal, it's a great exercise. And then the next one and the next one will get better and better.
So I guess if I summarize the answers, because these are great insight, it's, discipline and integrity. Find something that you like and put all the effort into it. It doesn't matter where it goes. If it's good, it will progress with it. So great, thank you. Maybe before we have to move to the next section, but I'll just ask the last question for this section. And if you don't mind, in a couple of minutes each, if you tell me what are the top 3 common fatal mistakes that you see in submissions?
Fatal as fatal, literally?
Like mortal, yes.
No. So can I? So let me start with 1 or 2, and then. So one of them is I've seen great science poorly written. When you cannot finish the paper because it's so poorly written, you don't understand what they're saying. It's really a pity. See, oh, this is looks like a great science, but I don't understand what they're saying. I think having a good English editing and take care of the form is very, very important. The second one is really overstating your finding or having nice analysis, but then really splitting and splicing and over concluding and having a conclusions that are not relevant or very far from your findings. And the third is any major statistical flaws. And sometimes as an editor, I can't pick that, but we have our statisticians. We like that paper, we send it to statistical review, and I get this back reject. I said, what's happening? I thought it was a great paper. And then the statistician would explain to us the methodology is completely flawed, and that will be another fatal.
Great.
So I don't have a lot to add to that. I think Hani hit the biggest one, and that's just the statistics are wrong or misstated. We all know that you know that a p-value is basically a representation of the probability of whether or not the null hypothesis should be accepted. And if we really believe that the p-value of 5% or less is desirable, if you just ask 20 questions, right, there's a good chance one of them is going to be statistically significant. And so I am bothered when you see data table after data table after data table that's got maybe literally 50 different statistical measurements, and the authors haven't bothered to do any sort of corrections for those multiple assessments. And they don't state that in their limitations, but rather they come up with multiple positive findings and multiple conclusions. So I think that's the most common one. The second, as far as fatal mistakes, is if the reviewers and editors feel strongly enough to ask for changes and you refuse to make them, and you don't carefully and politically and scientifically defend your reasoning, yeah, that's kind of an affront. I would say piggyback onto that one, and I know everyone who's reviewed a lot of manuscripts will see this, is that you review a paper and you make many, you believe, important comments about the paper, and ultimately it's not accepted, but it goes to another journal and it's not been changed at all. Every one of the comments you made about that manuscript as a reviewer, now because you're an expert, and Hani's a great example, he's an expert, and so he's going to see maybe the same paper from different journals, and when it comes back to him and every comment he made was ignored on the resubmission to a new journal, immediately his antibodies are all ready to reject that paper again. And then the last one is a minor one. I don't let it bother me too much, but if they send me a cover letter and it's addressed to the wrong editor or to the wrong journal, yeah, I think, oh goodness, they didn't even look twice to correct my name or to correct the journal to whom they were sending it.
All right, no, these are great comments. Thank you. So we'll spend maybe 15 minutes on the backstage questions, and maybe for those one we'll just do rapid fire because we have a lot of them. We just cover as much as we can. This is just a personal question that came through. How many hours do you spend doing editorial work a week?
22.
Okay.
No, you said rapid fire. So interestingly, I did the month of January and the month of February, and I wrote down every time I literally sat down and worked, not just thinking, but worked. And so, yeah, I think it was 22 hours in January and February per week.
Great.
So myself, I'm a senior associate editor, so I'm not the editor in chief. I spend between 8 to 12 hours. And I do that early morning hours. I'm now becoming a very early morning person. 4 or 5 a.m. is when I have my coffee and my journal reviewing.
Well, that's great. So some questions that came about, the inclusion of, various specialties in the journals. So I'm sure now JAHA is a very broad journal, so I'm sure you have people from all over. But it seems like we've got some surgeons on the audience, and they've sent questions about sending reviews and inviting editorials and maybe editorial board membership to surgeons. And a similar question came about handling, equity with gender and race in the editorial boards. So that's tough to do with rapid fire, but we'll try.
No. I think that the easy answer is you have to actively do these things. And so it's popular to talk about diversity and inclusivity and commonality, but you have to actively do it. And so when I became editor-in-chief, I very specifically, in fact, when I lobbied or presented to be the next editor-in-chief, I came up with a plan, and I told them the book I read, and I told them my strategy. And so if you look at the editorial board, in fact, for JACC Cardiovascular Interventions, you're going to see people from all over the world, from the Middle East, from the Far East, from Europe, from North America. Now, we don't have many surgeons. We have several, but we don't have many. But I very purposely tried to get people from around the world. The second thing I did is I tried to get people, not just the very, very senior faculty, but I tried to get a number of mid-career faculty, because if we don't grow the next generation adequately, we won't be ready. I think the toughest thing, and Hani may chime in with this, is females. So as the audience may know, and certainly Mohamad and Hani know, is in the United States, at least only 14% of cardiologists are females. And then if you go to interventional cardiology, it's even lower, it's around 8%. And so it is quite difficult, right? Because every journal is looking to have a few, female interventionalists on it. And it's tough because they're busy. And so that's been my biggest challenge, though we've been successful. But I think that's an ongoing problem for many journals, is to have an adequate representation of female associate editors and board reviewers.
Mhm. And I mean, I echo what David stated. I mean, JAHA as well abides and is aligned with the mission of the American Heart, which is all for diversity, equity, and inclusiveness. And if you see the editorial board, this is all reflected in the editorial board. You've got editorial board that fits this spirit. So you get, I think, well-balanced editorial board, geographically, gender-wise, racially, and ethnicity perspective, and from a expertise perspective. We even started an early career board, which is an initiative I've done with the editor-in-chief. And this is going into its second year right now. And I remember when we had the nominations, we ascertained that we have equitable representation in terms of gender, in terms of race, ethnicity, and even international representation, and representation across the board in terms of junior, very junior fellows, even somewhere fellows and some early career, and across the board, basic science, outcomes research, interventional cardiology, and so forth. So this is very well reflected in the JAHA board, and as well in the early career board. Now, for the surgeons, I think JAHA would represent a great niche for publishing surgical papers. And we welcome papers from surgeons. We do have on the board more than one surgeon, and invariably in our weekly editorial meeting, we invite one of our colleagues from the editorial board, a surgeon, to comment on some journals that have some surgical papers. Yeah, we welcome surgical papers. JAHA is a wide breadth. We welcome surgical papers. We welcome papers in pediatric cardiology, in adult congenital heart disease. So we really have a very wide scope, and surgery definitely is at the core of it.
No, I mean, I like what David said, that we have to do these things actively, and I think in general that our cardiology journals are pretty inviting to surgeons, honestly. And I would like to see more cardiologists being invited to write editorials in surgical journals and to give talk in surgical meetings. It's really hard to find a single cardiologist now giving this talk. So I appreciate the question. I think the journals are doing well, but we can do more, obviously, but it has to be a two-way street for all of us to grow together. The next question that we have is, does the journal impact factor, is that just something that you discuss at the end of the year, or is that something that comes up frequently as you're reviewing paper? Well, this paper will be highly cited, so we should take it or not. I guess this is a curious question.
So I think that you kind of already answered it. Yes, we look at it once a year. We are mainly looking for high quality papers. Having said that, they go hand in hand, right? They're directly linked. We know that high quality papers are more likely to be cited than papers which aren't of particularly high quality. But in deciding to accept a paper, we don't say, oh, this is going to be cited a lot, we need to publish it. No, if we believe it's of great science, we know that it will get cited enough. So I would say it's an indirect yes, it is important, but it doesn't really affect our individual paper level decisions.
Great.
Yeah, and likewise, I agree. We look once a year into the impact factor, and quality of the article really what matters. Now, if it's a great quality and it's a likely to be highly cited, then we may even expedite it. And also we put a lot of emphasis on social media, not only the impact factor. There's now all this impact factor on social media, which you may be an expert on, Mohammed, more than I do. We have a social media editor that takes care of that and point out to us which articles are more likely to generate social media attention.
The next question is, do you provide feedback for reviewers who review the paper? Because, sometimes they review the paper, they see the decision, they don't know, they learn from reading the decision letter, probably, what they did wrong, what they did right, and whatever. But how, this is a question from junior reviewers, how do I do better? Obviously, there's always so many hours in the day, but do you provide specific feedback, or should I just wait until I get an invited editorial and that's my feedback, or that I'm doing okay?
So yeah, well, you mentioned some of them. I think one is that as you start out being a reviewer, chances are you've got a mentor already, and that person should help guide you and groom you to be an excellent reviewer. I feel strongly about that. The second thing you also mentioned, and that's the idea of reading and writing, as Hani also said. So I think that whenever you review, do a good job. Don't accept to do a review and then do a lackluster job. It's really going to be wasting your time and the author's time and the editor's time. So if you make a commitment to review a paper, do a great job. I'd rather see, especially junior people, do fewer reviews, but do just really outstanding reviews. And then when the decision letter does come back from the journal, don't just cast it aside. Take time and read it. See what comments the other reviewers made that you missed. Chances are you'll feel good because the main things that you felt strongly about, probably the other reviewer did too, so there's some reinforcement, but you'll get a sense for, did I put enough comments in? Did I put too many in? Things like that. So I think in the beginning, nobody expects you to be perfect, but I would say, do your best work.
Yeah. Actually, this last point that David stated is really an excellent one, and I do that all the time. I always look at the second reviewer. If I act as a reviewer, serve as a reviewer, I try to see if my review is concordant with the second or third reviewer and see what I missed, and that's how I learn to be a better reviewer. Now at JAHA, we grade the reviewers in terms of, we have a grade: good reviewers, mediocre, not so helpful, and bad review. But more so for our early career board, we came up with a scheme actually, whereby we grade the review, the early career reviewers based on many measures, including timeliness, concordance with the more senior review, which doesn't necessarily mean bad or good. We realize they're not, concordance is not necessarily appropriate or the right thing to do. But we came up with an even measurement scheme for the early career, and we summarize those and we send them the feedback. Tell them, listen, you were timely, you were concordant, and this is the grade of your review. So that's how we teach them to be better reviewers. The last point, pardon me, Mohammed, the last point I want to make, oftentimes when we have a major revision that we ask for as a reviewer, at least in JAHA, we resend for the reviewer to re-look at the revised manuscript. And it's very important for the reviewer to look again and make sure that the authors or investigators really revise the paper satisfactorily. What I find sometimes is they just sign off, said, oh, I already reviewed it, I don't want to bother again, then they sign off. And that's something that doesn't go well with me. And this is when the second score for that same reviewers, when they do a very quick review the second time, would come lower if they don't re-review in a meticulous fashion.
Great point. The last question of this section is the two-way street situation. So, most of the time, the interaction between the editorial board and the editors and the authors is just through the submission and the decision letter. I have to say that I remain impressed by. Remember, I think Dr. Moliterno called me one time. That was the first time I spoke with him. Actually, it was a few years ago when we submitted a paper. I was in West Virginia back then. And I sent an email to the generic email, for the journal. Did not expect a reply, not even by the editorial. That's what usually we don't have high expectations. And then saying that this paper has been in review for a long time. Can you please give us an advice? Is there anything we could do? And then the response was a phone call from David telling me, why is taking so long? And it was a state-of-the-art review. It wasn't even, a data paper, but we discussed some things on the phone, and he said that we'll get a detailed letter from the associate editor with suggestions, and it was eventually published and well cited and received. So I think, but that was very impressive. I don't know how often or what's the capacity. Uh, does do you suggest that authors who have feedback or questions to be proactive and reach out to the journal, or is that way out of capacity for the editors? And what advice do you have in that sense?
I think that so I go back again to this idea of mentor and collaborators and co-authors. I think that if it's something that important, chances are your mentor or your co-authors are going to give you guidance. So the first thing I would say is don't react out of emotion. So if your paper is rejected, yeah, don't just get angry and 5 minutes later send a negative email. Talk with your co-authors. If they agree that it shouldn't have been rejected, you can always appeal. But I would just caution with lashing out. That rarely happens, but every once in a while somebody will send a nasty email, and so of course I very diplomatically and politely respond to it. But you can tell from my gray hair too, I'm a little bit old school. I'm not afraid to pick up the phone, and that's something that I think the generation after me is more quick to send a text or an email or post something on social media. Yeah, I find the most effective thing is just person to person, mano a mano, picking up the phone. And like with your case, I had to apologize. We were taking too long. But I'm passionate about state-of-the-art papers, and you know that, Mohamad. And so if you send me something that I think is pretty good, but it's not great, my job is to make it great. And I'm not saying it's on me, but I think the idea of if it's really going to be state-of-the-art, like your coronary aneurysm paper, I remember, it has to be the best of the best. And so we're going to work on it and work on it. And sometimes that takes extra long. I think it's fair game to say, the reviews weren't that fabulous, and did they really do a good job? And so you're right. My job is to make sure that the reviews you're getting are reasonable. Sometimes they're not, and I'll have to write them in the decision letter. The reviews weren't super helpful, but the editors carefully discussed this, and here are the main 2 reasons that we ended up rejecting the paper. So we may talk about this some more, but I'd like to come back to it if we have time. But I know this was rapid fire, so let me pause and let Hani say something.
Well, you've said it all, David. I want to say I remember also a discussion I've had with you regarding one of our papers on a Saturday or Sunday morning, maybe 2 months ago. So I echo what Mohamad said. David is dedicated and follow through, and I appreciate all what you do at Jack Intervention. I have one little thing to add to the appeal thing. I mean, you can appeal. You should have a strong reason to appeal. And remember, you can appeal one time at that journal. But I mean, repetitive appeals won't be looked upon very favorably when you do it at the same journal. So if you want to appeal, you really have to have a very, very strong reasoning why. Because I think in a period of time, you will have one chance in one paper. And we infrequently have appeals. And sometimes we accept, we say this is reasonable. And we want to ask for a second set of reviewers. And yeah, the authors, if they're correct and there are things that we missed, then the appeal will be accepted. But what I want to say, don't, for the young investigators to go for their mentors and certainly not lash out and not abuse the appeal system. And also it helps if your mentor would know somebody from the editorial board and email the editor-in-chief or a member of the editorial board and put forth a very objective way of why this paper should be appealed.
What I'm getting also is that we want some resurrection of this mentorship, collaboration, discussions, talking. It seems like more and more we're leaning toward like send a rapid email, get this out quickly and stuff like that. And I didn't tell you this, but when you called about that paper, the first author, who was a first-year fellow back then, he's on staff now, was with me in the office. We were talking about the next case that we were going to do in the cath lab, and this was his first paper ever, and it made such an impact on him. He has published multiple ones in your journal after that, in both journals actually, but it made such an impact that this is an exciting field, and there is mentorship, and there is, back and forth talking and stuff like that. So I think maybe we should emphasize that more in the future, that it's not just, submit and get more numbers and get more citations. It's a learning process that is enjoyable. So last few minutes, maybe, we'll talk about some questions that came about the future of journals. There are a lot of social media noise, so to speak, or maybe even legitimate concerns about the longevity of the journals as they are now or as is. The first question is online only format the future, inevitable future for any journal? Now, that question can apply to Hani because it's already online, but maybe we'll ask David.
Well, I think it would be silly to say that no, everything's going to be in print forever, right? So we know that ultimately, print media will go away. Having said that, I think it's still a ways off. It's like the robotic cath lab, or it's like genetics and medicine, or even personalized medicine. These things are all conceptually true and real and are part of our lives, but they take much, much longer to take over, right? Whereas we might think, oh, in 5 years, we're not going to see this or that anymore. I mean, goodness sakes, look, we're still doing balloon angioplasty, 30 years later now, largely in the periphery maybe, but stents haven't taken over everything. So too, I think that there are a number in my generation in particular who still like looking at print media. I do think that we will continue to go further and further online. I do hope we maintain the peer review process. I thought that's where your question was going, is, should we just put it out there, online and let the experts on social media criticize the paper? No, I think there's a great value to excellent peer review, and I think we should go that way. Now, on the flip side, I'll say this before we turn to Hani. There is something like between 130 and 140 cardiology journals right now in the world. I cannot believe that we really need 130 to 140 cardiology journals. I don't know what the number should be, but we have too many. We can probably have a fewer number of high quality journals, and then if the rest, want to be just online only without peer review, so be it. But I think we'll always need, the top journals to give us the purest papers possible.
And maybe, some sort of a hybrid approach where the reviewers can some question came about publishing the reviews online along with accepted papers or something. So some sort of a hybrid model where you could, have some more connection with the authors and readership. So Hani, maybe we'll have you answer that question and also tag it along with, I remember David wrote a corner about JAK intervention 2.0 when he started. What's, maybe a difficult question to answer, but what's JAHA 3.0 or 4.0? And then we'll come back to Dr. Moliterno and ask him the same.
Yeah, I need to discuss with the editorial board and the editor-in-chief. But one of the exciting things we've done recently and we want to expand on is the early career board at JAHA. And we were a little bit slowed down by the COVID-19. But we, from now on a yearly basis, we will be picking an early career board of either junior faculty or fellows that will matriculate to this board for a 1 to 2 year term. And they're tasked with becoming not only peer reviewers, but also writing. We have something called early career board perspective that they write with a senior mentor from JAHA editorial boards. And they have the opportunity to write one mini review and do some other tasks that are related to the editorial board of JAHA. So the early career perspective is one initiative that we want to expand on. Also, we want to expand the scope of the journal. I mean, again, we are the Journal of the American Heart Association, and areas like cardio-oncology, for example, surgery, adult congenital heart disease, and other areas. We are the journals for those. We are the journal for those fields that don't have any specialized high impact journals. So we want to increase the reach for these areas.
Great. No, and I think the early editorial board it's a theme, and it's appreciated by most of the junior people that they're getting to be involved more and more with journals. So what's 3.0, Dr. Moliterno?
We'll see. I'll give a few hints here and there, but you've mentioned a couple of my editor's pages, and so I'll apologize to those who are watching this now or in the future. I haven't done many editor's pages for, gosh, maybe a year and a half, 2 years now. The reason being is I enjoy writing them. They obviously take a lot of time if you write them well, but what I found is that, people aren't going to cite them, not that they need to be cited, and people don't talk about them, not that they need to be talked about, but rather what I thought I should do is take whatever time I had and make the papers better. And so like we alluded to a few minutes ago, it's almost like being the sculptor. I try to find papers that are pretty good, and how can I make them better? Helping the authors, helping the readers, and so that's what those 22 hours a week I mentioned, a lot of that's really just trying to make papers the best quality they can be. And as a result, our submissions have gone up tremendously. I get 12 papers a day on average. And I feel bad that several of them are going to get rejected without a review. But of all the things we've talked about now this afternoon and evening, it's very demanding to ask more and more people to review papers. And what I'm really looking for is papers that are of reasonable quality that we can get very good reviews for. And that may be, unfortunately, sacrificing some papers that they don't get a review done on them. But it's all about quality. And I know that you say, what's the future? The future is still trying to get the best quality papers that the reader wants to read. And so that's what we do as an annual survey. We try to figure out, are we hitting the mark? Are we missing topics? And so we talked about impact factor earlier. Yeah, I don't care so much about ours, but what I'm watching are trends over time. Are the journals with whom are in the same space with us, and you know who they are their impact factors going up and ours going down? And I'm looking at that trend. So what are they doing, or what papers are they taking, or how are they producing better papers? Because it's not necessarily me wanting to have the best journal, but me wanting to have the best journal for the readers, right? Because why else are we doing this? It's for the readers. With regard to 3.0 or 4.0, I think you can use your imagination. The New England Journal has gone in this direction. What we did this past year and a half was to try to get high quality central illustrations for every single paper. Back the paper you talked about earlier was just for state-of-the-art papers. We would try to do a very nice central illustration for state-of-the-art papers. And then what we shifted to, maybe with 2.5, was getting a central illustration for every single original research paper. That idea, that concept is going to evolve further, and you can imagine what can happen with electronic media, how we can make that central illustration living. And so that's what's going to happen, I think, next.
That's great. And speaking of social media, it seems like most journals are investing in that as a way to convey information. But there were some questions / suggestions about expanding that further. For example, maybe now, especially with taking advantage of the post-COVID, theme of Zoom and stuff like that, maybe an online journal club once bi-weekly or once a month for the an editor pick of a topic or something that people can contribute to and learn. Because now what we learned from COVID is obviously we could do a lot more with online and virtual learning. So that just a suggestion, a question that came from some audience. I think we're close to the top of the hour, and some of the other questions were nuanced questions. So I would just want to take a final minute to get a closure statement and an advice from both of you.
Hani, please go ahead.
Thank you, David. Well, it's a pleasure participating with both of you. Thank you, Mohamad, for the kind invitation and privilege to be with David in this venue. One comment is for the junior folks up there, the early investigators and the early career and the fellows. is to keep writing and getting involved in research endeavors. There's no endeavor that you learn from every attempt. You learn always from writing. Identify the right mentor and listen to the mentor as well. And aim high, but don't get disappointed if you don't go to a high impact journal. You learn by repetition, and you learn by trial, and you learn from mentors, and you learn from experience. And if you don't start, you don't finish. That's what I would say. And it's fun, and learn by doing or by writing.
You know, Hani, you're prompting me to make the next session on mentorship, because I think that's one of the toughest thing to pinpoint to and to understand and to practice. Thank you. Appreciate you joining us today. All right, last word from Dr. Moliterno.
Yeah, so I think, you know, again, I'm old school. It's all about the patient. So I love research. I love teaching. I love being in academic medicine. You know, we're so richly blessed in this country to be able to care for patients, to have them trust us and be able to, you know, try to help them throughout their lives. And so for me, you know, doing the research, doing the teaching, publishing papers, you know, at the end of the day, I say, am I making patients better? Am I improving the quality of their lives? And so that's what I like to instill, the passion I like to transmit to the viewers and to those people who are involved with academics. You know, everything we do, it should ultimately be back for the quality and the duration of our patients' lives, trying to prove that to the best of our abilities. It's a great privilege. It's a great honor. And just as it is being with everyone here on this Zoom meeting today.
Thank you. That's just a great, you know, final advice. I think I should say nothing after that, so not to ruin it, but we can always get lost in the details and, you know, forget the purpose and the bigger vision. So I really appreciate that comment, and appreciate you both being with us. For those who joined us, thank you very much. If you have more questions, you could submit them, and we'll try to email the editors and get you answers. This will be available via YouTube as well, and the link will be available on the Minnesota chapter of ACC board link or Twitter account too. So thank you very much, and have a great night. Thank you, both of you.
Thank you. Cheers.
Thank you very much.